Pregnancy triggers profound physiological transformations, extending far beyond the obvious visible expansion of the abdomen. While many people expect weight gain, stretch marks, and temporary changes during pregnancy, fewer understand that some alterations persist long after delivery, fundamentally changing the body's structure, hormonal environment, and even cellular composition. These permanent changes span multiple organ systems and represent adaptations that supported fetal development but remain etched into maternal physiology for decades or life. Understanding these lasting effects provides realistic expectations for pregnancy and postpartum recovery, while highlighting the remarkable biological transformation that motherhood entails. Some changes carry health implications, requiring long-term management, while others offer surprising benefits or simply represent neutral adaptations to having carried and delivered a child. Skeletal changes, including foot and hand size. Many women notice their shoes no longer fit after pregnancy, a change often attributed to temporary swelling. However, for many women, foot widening and lengthening persist permanently. The hormone relaxin drives this change, increasing during pregnancy to loosen pelvic ligaments. However, relaxin acts systemically, affecting ligaments throughout the body, including those supporting the foot arches. As weight-bearing ligaments in the feet relax, the arches flatten and spread under increased body weight. This flattening widens and lengthens the foot. While some women experience reversal after delivery, others find the structural changes permanent, particularly after multiple pregnancies. The result is an increase of 1/2 to 1 full shoe size that persists indefinitely. Similar mechanisms affect hand size, though less dramatically. Some women notice their fingers widen slightly, making rings tighter even after postpartum swelling resolves. Breast changes from lactation. Breasts undergo dramatic transformation during pregnancy and lactation. Hormonal changes stimulate milk-producing glandular tissue, causing breasts to enlarge substantially, often doubling or tripling in volume. Following weaning, the glandular tissue regresses. The breasts lose this functional tissue, and tissue proportions shift. Many women experience decreased breast volume compared to pre-pregnancy. The skin that stretched may not fully retract, contributing to changes in breast shape and firmness. Beyond cosmetic changes, breastfeeding provides protective health benefits. Lactation reduces ovarian cancer risk, with each additional breastfed child providing incremental risk reduction. The relationship between breastfeeding and breast cancer proves more complex. Pregnancy itself slightly increases risk for certain aggressive subtypes, though breastfeeding appears to offset some of this increased risk. Pregnancy as cardiovascular risk assessment. Pregnancy places substantial metabolic and circulatory demands on the body, effectively functioning as a physiological stress test revealing underlying vulnerabilities. Women who develop complications including gestational hypertension, preeclampsia, gestational diabetes, or deliver unusually small babies face elevated cardiovascular disease risk later in life. This predictive value matters because cardiovascular disease represents the leading cause of death among women. Pregnancy complications often manifest decades before cardiovascular disease would otherwise become apparent, providing a window for preventive intervention. Women who experience these complications benefit from enhanced monitoring, lifestyle modifications, and potentially earlier cardiovascular screening. The mechanism linking pregnancy complications to later cardiovascular disease likely involves shared underlying pathophysiology. Endothelial dysfunction, insulin resistance, and chronic inflammation that produce pregnancy complications represent the same processes driving atherosclerosis. Musculoskeletal changes affecting posture and joints. The biomechanical demands of pregnancy alter the musculoskeletal system in ways that frequently persist postpartum. The growing uterus shifts the body's center of gravity forward, necessitating compensatory changes in spinal curvature. The lumbar spine increases its inward curve to maintain balance. Meanwhile, relaxin loosens ligaments supporting weight-bearing joints. These combined effects create vulnerability to pain. The altered spinal curvature strains muscles and can compress nerves. Loosened ligaments reduce joint stability. Weight gain further loads compromised joints. Many women experience persistent back pain, hip pain, or knee pain that began during pregnancy and never fully resolves. The structural changes to spinal alignment may not completely reverse after delivery, particularly after multiple pregnancies. Physical therapy, core strengthening, and postural awareness can mitigate these issues, but may not eliminate them entirely. Pelvic floor dysfunction. The pelvic floor, a hammock of muscles supporting the uterus, bladder, and rectum, endures tremendous strain during pregnancy and vaginal delivery. The weight of the growing uterus presses down on these muscles for months. Vaginal delivery stretches them dramatically as the baby passes through. Even without visible tearing, the pelvic floor muscles and their supporting connective tissues can sustain damage. For many women, this results in permanent pelvic floor weakness. Symptoms include stress, urinary incontinence, the leakage of urine with coughing, sneezing, laughing, or exercise. Even a single vaginal delivery increases lifetime incontinence risk. Multiple deliveries compound the effect. More severe pelvic floor damage produces pelvic organ prolapse, descent of pelvic organs that creates a vaginal bulge. Women with prolapse may experience pelvic pressure, difficulty emptying bladder or bowels, or visible tissue protruding from the vagina. While severity varies, pelvic organ prolapse represents permanent structural change requiring ongoing management. Pelvic floor physical therapy and targeted exercises can improve symptoms substantially, but rarely reverse the underlying structural changes completely. Some women ultimately require surgical intervention to manage severe prolapse or incontinence. Prevention through pelvic floor strengthening before and during pregnancy may reduce but not eliminate risk. Abdominal muscle separation. The rectus abdominis muscles, the paired vertical muscles forming the front of the abdominal wall, must separate to accommodate the expanding uterus. During pregnancy, hormones soften the connective tissue, while the growing uterus pushes the muscles apart. In many women, the muscles return to their pre-pregnancy position postpartum. However, in others, an abnormal gap persists, a condition called diastasis recti. The separation creates a visible bulge when abdominal muscles contract and can cause persistent abdominal and back pain. Diastasis recti severity varies from minor separation causing primarily cosmetic concern to substantial gaps producing functional impairment. Physical therapy focusing on core strengthening can improve symptoms. Severe cases sometimes require surgical repair. Fetal cells persisting in maternal tissues. One of pregnancy's most remarkable long-term effects occurs at the cellular level. During pregnancy, fetal cells cross the placenta and enter maternal circulation. Rather than being eliminated, some take up residence in maternal organs including brain, heart, lungs, liver, and kidneys, persisting for decades. This phenomenon, fetal-maternal microchimerism, means women who have been pregnant carry cells containing their children's DNA throughout their bodies for life. Fetal cells appear to contribute to tissue repair at sites of maternal injury, potentially functioning as stem cells. Studies suggest possible protective effects against certain cancers and neurodegenerative diseases, including Alzheimer's disease. The persistent fetal cells may modulate maternal immune function or participate in tissue maintenance and repair. Reframing pregnancy's permanent changes. Cultural narratives often frame pregnancy's lasting bodily changes negatively, emphasizing appearance alterations and physical limitations. While acknowledging challenges some changes create, particularly pelvic floor dysfunction or chronic pain, these changes can also be viewed as markers of the remarkable transformation the body underwent to create life. The physical changes represent badges documenting the extraordinary feat of growing and delivering a human. The protective health benefits, early cardiovascular risk assessment, and cellular contributions from fetal microchimerism demonstrate that pregnancy's legacy extends beyond challenges. Understanding what changes to expect, which may be permanent, and what interventions can help empowers women to advocate for appropriate postpartum care and long-term health monitoring.